Hey, my name is Asia. I'm going to pretty much just talk about my journey when I was in occupational therapy assistant school. I am no longer in school because I graduated, I got a couple of jobs, and not in school anymore. Um, so pretty much I decided to make this video because there's not that many platforms for occupational therapy on YouTube. There's not that many platforms about, people's journey in school and what they went through. So these are some things that I just want to touch on in this video. So I'm just going to dive right into it. First semester, most programs will require you to take an intro to occupational therapy course. I took that course and I could pretty much say it was a lot of just memory based type of questions, and the way the test was, it was pretty much just a lot of memory. So if you're really good with memorizing, you should do very well in that course. And I forgot the other course that I took. But moving on to second semester, it did get a lot harder, of course. I think that semester was more challenging because I had a structure, I think it was a structure and function course. Yeah, that's what it was called. It was called structure and function. So structure and function, it kind of reminds me of your anatomy and physiology type of course, but maybe with not as much of the physiology portion of it, just mainly anatomy. But I think that semester, it's like you really learned application-based problems, and just knowing that you can't survive through the program with just memorizing everything. It's a lot of application-based, not just knowing something, but just knowing how it relates to the body, what movement it will do. So that semester was a lot more challenging. A couple people fell out of the program because they couldn't keep up, and they usually called out the they usually call it the weed out course, where if someone is not keeping up academically, that's when they normally will see it, and because it would reflect in their grades. Another course that I took, we had to take that semester, was a pathophysiology, pretty much just signs and symptoms of different diseases and typical diseases and abnormalities you will see working in the field as an occupational therapist assistant or an occupational therapist. Like when you're going to see a lot of TBI patients, you're going to see a lot of stroke patients, you're going to see a lot of, if you're working in pediatrics, a lot of children with cerebral palsy. So it's pretty much just a lot of, diseases, and knowing the signs and symptoms, and, different therapeutic activities that you can incorporate into those treatment sessions with these type of individuals. And moving on to third semester, so I think that semester was our busiest semester. We all had 4 courses. We were at school from like 9 to 3:45 every day. I can't really remember too much about the courses specifically, but I don't remember it being as challenging as the summer. I do remember it just being really busy, because on top of class, we had to go volunteer at different places. A lot of these places were adult daycare centers, respite services for children with special needs, or it was any type of psychosocial setting that you might have to go do a level 1 rotation on. So I believe third semester was just very busy and not as stressful, I guess, as far as academic. I'm losing my train of thought. It just wasn't as stressful as academically as the previous semester. And fourth semester was when we started our level 1 and level 2 fieldwork rotation. So level 1, you just pretty much go to a psychosocial setting, and a psychosocial setting would be like some type of adult daycare with people with, the place I went to, it was people with visual impairments and intellectual disabilities. And we were there, we would go for 7 weeks, and I think it was every Friday. And it was a full day from like 9 to 3:30 we would go, and we would just pretty much just help out with I forgot what they call them. Oh, I think it's called a recreation therapist. We'll help out with a recreation therapist, I believe. Don't quote me on that. And just help them set up for bingo. And we had different activities that we would have to do with these clients that was mandated by the state. And that was a good experience, just to, just to start, getting me and everybody else just used to working around people with disabilities. I think that was like just a huge eye opener, just having that level of communication. And you just got to start somewhere. So that was cool. And then I moved on to my level 2 towards the end of the semester, which lasted throughout the summer. And of course, that's every day for 8 weeks. You do 2 level 2 rotations, and it's full days. You're working full time with whoever your fieldwork educator or clinical instructor, CI, whatever you want to call it. Everybody calls it different things. You're just working full-time days with them, learning the ropes. And that was pretty much it. And that was my journey while I was in school. So if you guys have any questions about my journey while I was in school, or my journey afterwards with taking the boards, applying for a job, or any of that, you could just ask down below in the comment section. And I'll see you guys next time. Bye.